But the goal today is we want to really define shared care. It's a word that we hear a lot. I'm not sure if you hear a lot. And we just want to demonstrate the value and how it can improve your potential outcome. And then teaching patients and families a methodology or different methodologies for how you can advocate for yourself and for shared care. So, Cheryl here, very familiar face, our chief patient advocate at 1104 Health and melanoma survivor herself. She'll be leading the Q&A with the two others. So I'll let her take it away from here.
Great. Well, thank you so much. And again, appreciate your time and some of you taking your lunch hour to join us. Shared care, like first, let's kind of define it. Anybody that's on your cancer team, whether it starts with your oncologist, your general practitioner, anybody that's helping manage your cancer treatment is part of your team. And you want to make sure that it is a fully collaborative and informative effort on all fronts. And that studies have shown by having very connected care, it does increase your survival rates. And it also probably makes your cancer journey a little more comfortable, if you know what I mean. So today, I'm really excited to be here and we're going to share two amazing stories. And I know, when you get a cancer diagnosis, it is a holy crap moment. But these two women, let me tell you, we're not talking about just any kind of cancer. We're talking about Toni, who's gonna tell you her story. She was diagnosed with stage 3B triple negative breast cancer in 2006. Yes, and 7 surgeries later, and she is here as a survivor to tell you her story and how she coordinated her team in her care process. And Megan O'Leary, we all talk about preventative medicine. Well, her story is going to put the big old exclamation point after preventative care. She went in for a routine colonoscopy and found out she had pancreatic cancer. That is just nothing anybody of us want to hear. She had developed a shared care team of 8 different doctors and care team people to manage her through this process. So we're going to hear a little bit about her journey and how the team worked. First off, to get us started, can you both go into, Toni, you first, then Meg, what did shared care mean for each of you in your cancer journey, and who was part of that team?
Sure. Cheryl, thank you so much. And everyone, thank you for joining us for this absolutely important session for today. To answer your question, Cheryl, shared care for me was really combining family, church, and doctors into what I was building as a care plan for me. I really didn't want to be dictated to during it because I was a single parent raising a teenager and working. So I really needed to be able to talk across the board with all 4, family and friends, my faith leadership team, doctors, and then quite honestly, myself, because there was more often than not where I was getting a lot of information and the effort to distill it into layman's terms to talk to maybe family and friends and to a minor, my daughter at the time, and then be able to sort of put on the good face to go to work. Man, I had to share something with work team. And for me, it was shared care was telling the story without sounding like I was going to fail this test.
And who was part of your shared care team? Oh, you already said that. Your hospital, your doctors. Yeah.
Great oncology team, great radiology team. I don't know if my daughter is on, but if she is, I would tell you she was the biggest cheerleader that I have ever had during this. We joke now that my breast cancer diagnosis is full grown. It's 18 years old and it's still here. But so is she. And more importantly, so am I.
And your daughter helped manage your whole process, and she was basically your champion.
I wasn't
which is
really sure if some doctors were going to cringe or smile because she always came in with her notepad, glasses tucked down towards her nose, like so, and prepared with her list of questions. So, yeah,
which is probably one of the most important people on your team for
I
sure.
wouldn't trade her for all the gold in Fort Knox.
Awesome. Meg, why don't you give us a little rundown on who was involved in your shared care team?
Thanks, Cheryl. And like Tony said, thank you to everyone for joining today. Shared care for me meant coordination and collaboration. From the get-go, given the way I learned about my cancer was through my gastroenterologist as I was going through that colonoscopy, and had an ultrasound where they did a look at my whole abdominal area, and they did a flyby of the pancreas, as you said, and learned about and saw my tumor. So initially, just starting with that gastroenterologist, I went right from there to her recommending a couple of pancreatic surgeons. And so, following my surgery, with surgery being a first line of treatment for me because of the my early diagnosis, I was able to just have first a surgery as that first line of treatment, but then quickly thereafter needed several other kinds of doctors, oncologists, hepatologists. So that coordinated care meant that I needed to create connections and sharing of information and reports and scans across all of those doctors. That initial doctor, my gastroenterologist, who was the top of my A team, and I have an incredible amount of gratitude for, she helped me to assemble that A team of doctors and helped me and guided me and coached me on how important it was to create that communication link between and among all of them. And unfortunately, technology wasn't easily, didn't make that connection easy. I had a different portal for every single doctor that I had. And so what it meant is oftentimes I would print out scan reports, I would print out doctor report, notes and reports, and even go and get my CDs of scans and CTs. And I would carry them in a bag, to every single appointment and share them with each doctor. And I would ask them to coordinate among each of them just to be sure that each doctor, while they had their specialization, that each doctor was looking at all of me more holistically and appreciating that, I had liver implications, with pancreatic implications, et cetera. So again, shared care meant really that coordination, collaboration to create that connected care, that all of them were on the same page, understanding everything about my diagnosis, everything about my treatment, and everything about me.
Yeah, that's a very important point that you brought up. So when you go from medical institution to medical institution, and we think we are here in the age of technology, but systems do not talk to each other. There is absolutely, even if you're in for our local area, Lombardi, and you're at Georgetown Hospital, the general hospital system does not talk directly to Lombardi. So you really have to physically go in there with that information. And, if you're transferred from one clinical trial to the next, they'll send the records, but they don't have access to the actual, real data. So that's a very important part of your shared care. Let's kind of go on to, what, before we get into kind of the methodology, let's talk about your diagnosis stories and what you wish you would have done differently if you would have had time. We'll start with, yeah.
What a question. What would I have done differently? I asked a lot of questions, Cheryl, but I honestly would say I would ask even more. I mean, it was 18 years ago when I was first diagnosed. So I really didn't know what to ask then. So, I relied on technology and the internet to throw a whole bunch of questions at me. Um, but I also have a family history. So when I say ask questions, I don't mean just from my treatment team. I mean ask questions of my family and get more data. I actually turned into the family's medical historian with my diagnosis because I violated the personal space of just about every family member I had, gender regardless, because we have it not only on both sides of my family, but also within both genders, reproductive organ cancer. And it tended to be a bit more tight-lipped back then than it is now. And I think that's because I have become our family's advocate for knowing our medical history. So I would definitely say ask more questions. One thing I would not change, though, even though this wasn't the real question, I wouldn't change how bullish I was about expecting my medical care team, from primary care to specialists like the ones that Meg was listing. I was very adamant about I still work. I'm still a parent, and I still want to have a quality of life. So I'm not saying no to whatever treatment plan we design, but the operative word in that statement was we, because I still had responsibilities outside of just beating cancer.
Yeah, and those are great points because I think everybody is in that same space. Your life can't stop, most of us, because of cancer.
Mm-hmm.
And an important part that you did bring up, and I think it is overlooked a lot, is heredity. If you are predisposed to anything, to any ailment, you really need to try to stay on top of it and do preventative medicine with that. And that's an awesome point. I appreciate that for sure, Tony. Meg, what would you do differently?
That's a great question. And as I shared earlier, that because I found my cancer by chance, meaning I wasn't looking for cancer, but my mother had just been treated for colon cancer. So that was my first clue, to your point, Tony, about what's the hereditary, what's the cancer in my family? What's the hereditary aspects of any kind of cancer in my family? And that was really one of the first ones I learned about. So with that as my first indication, her surgeon said to me, run, don't walk to get your first colonoscopy. And I was in my, mid 40s. And in my mind, I was a long way off, doing any kind of preventative screening like that was a long way off, meaning I was still in my 40s. I felt like that was not in the something I had to do right away. But with that as a directive, that's exactly what I did. And I'm so thankful that I did, because as I said, during that scan is when they found my the neuroendocrine tumor in my pancreas. And once diagnosed, just as you said, Tony, it became about asking questions. It became about doing a deep dive to learn, what is this diagnosis? What does it mean to have neuroendocrine cancer in the pancreas? And to educate myself enough so that I could ask the kinds of questions that would help me to understand the diagnosis and to understand what the different treatment options are. So what would I do differently? I just wish that I could have known sooner, because perhaps I could have caught it even sooner. And then again, just building on what you said, Tony, just continue to ask more questions, and really being in the driver's seat of my own care and owning that.
Yeah, that's super important. And I think that was one of the things that I learned through my journey is, doctors are practicing medicine, and no question is too stupid. I mean, we are, when we get bounced into this whole cancer job, most of us are cancer illiterate, and we have to get ourselves up to speed. And the only way to do that is ask a lot of questions and take a lot of notes. And hopefully that you have somebody like your daughter that's sitting around there transcribing for you, because when you're listening to the responses, it's usually just an absolute blur. over your head. Meg, did you have somebody that was accompanying you on all your cancer appointments, or were you just going solo?
I had my family. My kids at the time were younger, so my husband did join me on a lot of my visits, and it was so important because it's hard to take in all of that information. One, it's very emotional to be hearing some of the things you're hearing as you think about the implications of this diagnosis. So my husband came to all of my appointments. That was huge.
Yeah, no, I think that's very, very important to have a concierge, somebody that's going
Oh, I
to
like that.
oversee. That's my word, man. So I think you've all kind of elaborated on your important steps to success, which is basically managing your care, putting together a good care team, and communication, and asking questions and being very prepared. Is there anything through each of your story that you think it would be important to share with somebody who's newly diagnosed and just going through this and just feeling like the weight of the world is falling on them right now, or they're drinking out of the hose, so to speak? Why don't you both go into putting yourself in that position again, and what advice you would give someone?
I have two things that I would definitely encourage anyone that's new on their journey. One more on the treatment side, one more on the personal side. On the treatment side, do not, under any circumstances, give your doctor full authority over your body. I know they went to school for 2,000 years. I know they have more degrees and plaques on their walls in their offices than you could ever imagine, but this is your body. And your body is truly your responsibility. You are not a textbook. That is what I said, from my primary care to every member on my nursing team, to the radiologist, oncologist, and every surgeon in between. This is my body. And I know when something is out of whack. And I get that your textbooks say, oh, if the patient complains of pain, then prescribe a pill. But I complained of pain and was prescribed the pill and ignored that and went to my next doctor's appointment and complained of pain and found out that my port was in upside down. This was 3 hours before my first chemo treatment. I had a bulge on the side of my neck. So please don't ever just abdicate your throne as the CEO of your body and, the one in charge of your cancer. Your team is just that, but you are still the coach. You got to be able to tell them what it is. And the second thing for me is, do not get caught up in the minutia of friends that sort of are in and out of your life. I have two types of friends. Okay. I have ride or die friends, the friends that have been with me forever through the diagnosis, before and after, and know what I need, to get by. And then I have what even lovingly I refer to as fair weather friends. They're with me for their benefit. It looks good to do a photo op with the bald head Tony. Okay. Yeah, that was great. However, I had to tell myself fair weather meant it would be okay on stormy days when I wouldn't hear from them. So just sort of set your expectations that friendships could get a little squirrely during your journey, but as long as you stay true to who you are and you can articulate, okay, may not have to be as blunt as me. Are you a fair weather friend, or are you a ride or die? But I did that because I needed to know how to categorize people during my treatment. Who can I call to go with me and my daughter to an appointment? Who can I call to bring over a casserole because I'm too sick to cook? Those are how I delineated who was going to be a real part of the personal care team. So those are my two recommendations.
Those are great points. I love that. I love ride or die. I think that's perfect. And two, if you got toxic relationships, get rid of them, because they are not going to be helpful in your cancer journey. So Meg, what would you like to share?
So for me, as with any cancer diagnosis, I really felt like time was of the essence. And I wanted to first prioritize getting my care team in place, because I felt like once that care team was in place, then that could set wheels into motion and actions would be taken, appointments and scans and tests, that kind of thing. And for me, that meant one, getting recommendations, looking at hospitals, institutions, whether it be Johns Hopkins, and I got several recommendations. But in addition to researching that each hospital, I primarily, as a priority, focused on researching the individual, each individual surgeon, because at the end of the day, I wanted to be confident that I had the best pancreatic surgeon that I could possibly have. And that just meant understanding how many surgeries they did, what specific area of the pancreas did they focus on, what specific area of disease did they focus on, and doing that level of research to then be able to make a comfortable choice about which doctor. And then once that decision is made and that those wheels are set into motion, secondly, I would say it's, researching and inquiring, doing the deep dive research to understand specifically what my diagnosis is, what your diagnosis is, to understand what your tumor is. And for me, that meant a pancreatic neuroendocrine tumor, which is actually a very rare form of cancer in the pancreas. So I really had to reach out, both using the internet, talking to doctors, talking to current patients, to understand the resources they used to understand the diagnosis and treatment options. And once you've researched, you can, as we've been saying already, then you can come prepared with lists of questions for every single doctor visit, so that you know what is it that I need to know to be both comfortable and confident in the care that I'm going to receive. And I'd say also, as just echoing, everything you've said, Tony, everything you said, Cheryl, is kind of the theme of insist and persist. Insist on the best care that you can get. Insist on coordinated care. And persist. Persist means, just as you were saying, Tony, don't stop at the first answer that you get. If in your gut, you're not feeling that comfort and that confidence that's what's the best option for you. So the persistence is to keep asking, to keep pushing for until you feel comfortable with the answer, until you feel comfortable with the approach for your care. And I love too what you emphasized, Cheryl, was that no question is a bad question.
That's right.
Every question is a good question. And so in your mind, if you're having any hesitant or doubt, I would just say, ask away. Whenever in doubt, inquire. Keep asking the questions and don't stop until you, again, get the answers and the care that you want.
Yeah, that you hit a bunch of different marks there that I think are very important. Number one, the most important person that you ever hire, as you can say as a consultant or whatever, is your oncologist. Right. You will never make, that is the most important decision that you're going to make. And make sure that your oncologist is familiar with your type of cancer. There are a lot of general specialists out there, but it's very important when it comes to treatment options, dosage, all that the doctor is familiar with that treatment, that drug, your cancer. And, after you do the interview, make sure that you're comfortable with that doctor. Does it have a good bedside manner? Because you're going to be spending a lot of time together, right? And really great. I just love it. Both of you guys are very strong advocates and absolutely led to your survival. And I'm going to turn it over to Shannon.
Yeah,
right now.
we have a few minutes left, and we have a question. I know this is putting everyone on the spot, but what would you say was the biggest barrier or a barrier that you found when you were trying to navigate? You all had so many good points, but what were the biggest hurdles or blockers to achieving that?
For me, Shannon, it was trying to get my doctors to understand that they were the ones with the degree and not me. So I appreciate that they could throw these polysyllabic words out at me and just sort of expect me to know what they were saying or understand the implications of what they were suggesting or recommending as a treatment. But I tended to go back and say, thanks, I need to digest this. I got to admit that didn't go over well with all doctors, but I can't make decisions that you're sort of reading from what I call your medical playbook. Okay, well, if the person has X, then you recommend Y. Having them care was the biggest hurdle for me because I needed them to personalize the recommendations that they were making per, the AMA or whatever journal they were reading or whatever trials they were, involved in. They needed to take into account me, me the person.
And Meg, I'm going to have you answer it too, but there was another question that popped up while you were speaking, Tony, that I feel like you can just answer to piggyback first. Did you get second opinions before settling on your treatment and your care team?
Every single time.
Every single time. Okay.
Every
and Meg,
single
same
time.
2 questions to you, the barriers, and then, did you get second opinions?
So excellent questions. I think for what comes to mind for me, in addition to what Tony has shared, is also time. Time is always of the essence, both as a patient, but then as you go into each of those doctor appointments, these are busy doctors, as you know, surgeons. I always felt like, this can't be a 15-minute visit, right? And how to get the most out of the time that you had with each of those doctors. And so sometimes if when I came in initially, the appointments would go too quick. And that's again where I learned that being prepared and having the list of questions. So when they say, okay, I think I have everything, and it would turn to me and I'd say, hold on, I got a list here, right? And so I'm going to slow this roll down, and so that we can take the time to go through each of my questions. So again, that I felt comfortable. And then secondly, what I also, I think, shared earlier was just that I found initially, I couldn't believe how difficult it was to share the information across doctors. So the more that you can do to create that connection with each one of your doctors, whether it's just even handing them paper notes that they ended up would fax and put right into your file. I just would emphasize the importance of creating that connection as much as you can through sharing of documents and reports. Oh, and the second question, Shannon, was second opinion. For me, again, because of the nature of how I found my cancer, my first diagnosis was with the initial scans that I got through my gastroenterologist. And so as I chose the hospital and I chose the surgeon, I went through an entire full second diagnostic process. And so I considered that to be my second opinion, to say, is this cancer in my pancreas, and what kind of cancer is it in my pancreas? And so I felt comfortable with that. But as Tony said, every time, all the time, I would always recommend a second opinion.
Yeah, and we truly appreciate your time and look forward to bringing Meg and Tony back on, because I think we could have some really great conversations. There's so many layers to cancer treatment and survival, and you two women have been amazing. And even just sharing your full stories, I think it would be a great opportunity. But please, feel free to reach out to us, 1104 Health. We'd love to help you navigate your process.
Awesome. All right. Thanks, everyone.